Okay, so if you're in the world of nursing home quality measures, you know things are always changing, right? It can feel impossible to keep up. Well, today we're going to cut through all that noise and give you a super clear, actionable guide to the most important updates out there. We're going to cover the big shifts coming in 2025 and 2026 and really sharpen your skills on those core measures you handle every single day.
So here's our game plan for today. First up, we're going to hit the really urgent stuff you need to prep for right now, that new antipsychotic measure and the big redefinition of falls. Then we'll shift gears and do a quick powerhouse review of some core clinical measures, just to make sure your current coding is rock solid. And we'll wrap it all up by showing you how to take all this data into the IQIES platform and turn it from just numbers into real, meaningful quality improvement.
All right, let's dive right in. Section 1, the critical updates. And trust me, these are the two biggest shifts you absolutely need to have on your radar right now.
Okay, first up is the new antipsychotic hybrid measure, which is set to take effect on January 1st, 2026. And listen, this is not just some tiny tweak, it's a fundamental change in how this whole measure is calculated.
And this slide right here really lays out the massive shift. See, right now, it's pretty straightforward, right? The measure is only triggered by what you code on the MDS. But come 2026, it morphs into this hybrid model. And that word "or" on the right side, that is the absolute game changer. What this means is, a resident could now trigger the measure even if there's nothing about an antipsychotic coded on their MDS. Wow.
So, you're probably asking, what kind of claims are we even talking about here? Well, it's a really wide net. It includes Medicare Part D, Medicaid pharmacy, even outpatient data. The bottom line here is that your QM score is about to be influenced by data that you don't even directly control. That's huge. Oh, and a little side note, but an important one, hospice claims are now officially an exclusion.
Okay, so what does this all mean for your QAPI team? What do? First off, brace yourselves. You should probably expect your reported antipsychotic rates to go up, at least at first. And it's not because you're suddenly prescribing more. It's because the system is now pulling from all these new data sources. So here's your pro tip. Start auditing your pharmacy data now so you can see who might trigger this new measure. It just makes your documentation and your focus on non-pharmacologic interventions that much more critical.
All right, moving on to our next big update. We're talking about falls. The RAI manual update coming in October 2025 is going to seriously change how we define and code falls with major injury.
This timeline breaks it all down for us. So right now, until October 2025, you just keep doing what you're doing with the current coding. But after that date, bam, the new, much broader definition of major injury kicks in. And here's a really key distinction to make. While a different quality program will eventually use claims data, your main 5-star falls measure, that's staying put. It's still going to be based only on your MDS coding. So don't mix those two up.
So what exactly is this new definition? Well, in short, the term major injury is getting a major expansion. It's going to cover all traumatic injuries from a fall. We're talking fractures, dislocations, concussions, the whole shebang. The practical takeaway? Your assessment and documentation after every single fall just became even more critical. I mean, absolutely paramount.
All right, we've looked at what's coming down the pike. Now let's switch gears and really nail down two core clinical measures that are impacting your scores today: catheters and UTIs.
Let's kick things off with catheters. Super simple. The numerator for this long-stay measure gets triggered when you code a 1 at item H100A. That just means an indwelling, suprapubic, or nephrostomy tube was there at any point in that 7-day lookback. I know it sounds basic, but trust me, getting this one right every single time is the foundation of good QM scores.
But, and this is a big but, there's a critical exclusion you've got to know about: neurogenic bladder. That's a condition where the nervous system messes with bladder control. And if a resident has that active diagnosis documented by a physician, boom, they're excluded from the measure. This can make a huge difference in your rate. This is a perfect low-hanging fruit for a QAPI project, by the way. Are you catching this for every resident who qualifies?
Okay, on to UTIs. Now this one can be tricky. To code a UTI at I2000, you can't just have one piece of the puzzle. You need all 4 of these things, and they all have to be documented within the last 30 days. A doctor's diagnosis, signs and symptoms, a positive lab result, and antibiotic treatment for that UTI. If you're missing even one of those 4, you cannot code it as a reportable UTI for this quality measure. Simple as that.
And that brings us to a super common point of confusion, asymptomatic bacteriuria. You know, when a resident has bacteria in their urine, but they feel fine, no symptoms of an infection. Just remember, for QM purposes, this is not a UTI. It should not be coded. Getting this distinction right is key to keeping your data clean.
All right, let's move on to our next section, which is all about preventative care. Mastering those vaccination protocols. We're going to tackle both the flu and pneumococcal measures together because honestly, the coding logic is basically the same for both.
So, how do you get credit for these vaccination QMs? How do you satisfy the numerator? Well, there are 3 ways to get it right. You either assessed and gave the vaccine, you offered it and the resident said no, or you assessed and there was a medical reason not to give it. Any of those 3 and you're golden. But here's the most important thing on this entire slide. A dash. You know, leaving it blank because the assessment was incomplete, that counts as a failure. It will drag your facility's score down.
You know, trying to track all of this can be a real headache, which is why having a solid system is so important. Something like a vaccination toolkit can be a lifesaver. It helps you pull everything together, your flu, pneumococcal, COVID, and RSV tracking. It helps you turn a bunch of separate tasks into one unified QAPI effort. And that just makes everything way more efficient.
And that brings us to our final and maybe most important section. This is where we tie it all together. Because look, it's one thing to know how to code, right? But it's a whole other ballgame to actually use that data. So let's talk about how to turn those reports you get from iKeys into a real, powerful tool for improvement.
So first, just a quick bit of orientation. For years and years, we all use the Casper system. Well, as of 2025, Casper is out and IQIS is in. That's the Internet Quality Improvement and Evaluation System. Now, the actual QM data itself, that's the same. But the platform, the website you go to pull your reports, that's completely new.
And this leads to the question we hear from facility leaders all the time. Okay, I figured out the new system, I've downloaded the reports, now what? What do I actually do with all this stuff?
When it comes to your QAPI, your quality improvement process, there are really 3 key reports you need to zero in on. First, the facility level report. That's your big picture 10,000-foot view of your rates and where you stand nationally. Next is the resident level report. This is where the magic happens. This is where you can dig in and see the name of every single resident who triggered a measure. And finally, the Care Compare preview. This one is absolutely crucial because it shows you exactly what your community, what the public, is seeing about you online. And this right here is your QAPI action loop. It's a cycle. Step 1, you pull those reports every single month, no exceptions. Step 2, you drill down into that resident level data to spot the trends. Step 3, you get those charts out and do some audits. Is this a coding problem or is it a care problem? And then step 4 is to act on it. Educate your team, implement a new process. Look, this isn't just a checklist. It's a continuous conversation you're having with your data. The goal is to stop asking what's our score and start asking why is this our score? Then you do it all again next month. So we're going to leave you with this final thought, a question for you and your whole team. Now that you know all of this, from the big hybrid measures on the horizon to the nitty-gritty of coding today, how can you take that monthly QM report, which can feel like just a bunch of numbers, and turn it into the launchpad for your next big, successful QAPI project?